Arthralgia versus arthritis. Arthritis is a term used when there is a limitation of movement in a joint associated with evidence of inflammation in the joint, swelling, warmth, redness, tenderness, along with pain on movement. While arthralgia can be defined as joint pain without evidence of inflammation in the joint space, the pain or discomfort originates in the joint itself. According to pathophysiology of 2, arthritis is a diagnosis characterized by joint pain and caused by inflammation. As I said, swelling, redness, and tenderness of the joint. Also, limitation in range of movement and stiffness. While arthralgia is a symptom, not a disease, also causes joint pain. It is not inflammatory and pain without swelling, only acnes. Types of joint pain. Joint pain can be inflammatory, mechanical, or idiopathic. Inflammatory joint pain or arthritis is often persistent and worse after a period of inactivity or in the morning with morning stiffness and relieved by exercise. And mechanical joint pain is intermittent, exacerbated by exercise and relieved by rest, usually has a history of trauma. While idiopathic joint pain is the most severe and unremitting, usually occurs together with fatigue and poor sleep, but there is no recognized organic pathology. Joint pain also can be caused by osteomyelitis, tumor, metabolic disorders like rickets, diabetes mellitus, hypo and hyperthyroidism, and genetic disorders. هنا اكو diagram يوضح الفرق بين هذين الثلاث انواع وياهم السينستر joint pain which is caused by malignancy. According to history, onset in inflammatory usually insidious and mechanical usually sudden. Sinister is insidious too. Course of the disease is a fluctuant in inflammatory type, in mechanical and sinister usually persistent. Radiation with time, inflammatory more in the morning and mechanical more in the evening, while the sinister has no relation. Relation to activity improves with activity in the inflammatory and worsens with activity in mechanical. Sinister worsens with activity. And example, inflammatory like juvenile idiopathic arthritis, where in mechanical like SCFE اللي هي slipped capital femoral epiphysis والsinister اللي هي malignancy. Starting with the approach to joint pain. Usually we start with history, identity, age, sex, ethnicity and race. Chief complaint is joint pain, then history of presenting illness. Onset لازم نعرف إنه هو sudden or gradual. Also we need to mention the duration like acute مثلا يصير بالtrauma or chronic may suggest serious underlying condition. Timing of pain, nighttime or daytime or in the morning on arising. يعني لما يكون in morning معناها هذا inflammatory type. During evening time or following trauma usually هذا mechanical type. Location and radiation of pain and number of joints involved. Also the quality of pain, severity of pain, does it interfere with normal activities or not? Progression over time, static increasing or decreasing, intermittent or persistent, frequency of pain attacks and duration of each episode. Also, we need to ask about associated symptoms like warmth, redness, swelling, morning stiffness, decreased range of movement, مثل ما قلنا هذني associated with the inflammatory type, lameness, refusal to walk, joint looking, joint giving away, fever, muscle weakness. Aggravating and relieving factors, certain positions, activities like swimming, rest, heat, or medications. Precipitating factors like history of joint trauma and recent illnesses like gastroenteritis. ممكن يعني gastroenteritis تسوي لنا inflammatory type. Pre-existing joint. نعم دكتور.
Reactive arthritis. This is called reactive arthritis.
Yes, post-infectious.
نعم.
Pre-existing joint disease like past history of trauma, pre-existing joint disease than past history of trauma to the joint, prosthetic joint, previous arthritis, blood dyscrasia, psoriasis, sickle cell anemia, diabetes, rickets, inflammatory bowel disease, celiac disease, chronic lung and cardiac diseases with hypoxia, cystic fibrosis, uveitis, tuberculosis, sexually transmitted diseases, exposure, and surgery. Medications history, recent use of medications like corticosteroids or non-steroidal anti-inflammatory drugs, and drug allergies. Immunization history, recent vaccinations such as Haemophilus influenza,
دكتور يجوز قطع النت يمها أو طفت الكهرباء يم.
لا بس ننتظر ماكو إشكال.
immunization, especially rubella vaccine, trauma, septic arthritis, hemolysis, effusion, strained ligaments or sprained muscles, dislocations or fractures, and respiratory tract infection, transient synovitis السوي, usually self-limiting and characterized by sudden onset of pain in the hips, thighs, and knees. Pyoderma, septic arthritis, history of drugs like penicillins, immunoglobulins, antitoxins, تسوي arthralgia or arthritis. Examination. Start with local examination of joints. Usually, also we need to examine the spine and muscles. Look for any rash or subcutaneous nodules, lymphadenopathy and sinuses. Eyes, oral cavities, desquamation of fingers, and focus of infection, organomegaly and cardiovascular system. In the joint, we examine the following: local temperature, tenderness, assessment of swelling or mass, spasticity, contracture, bone or joint deformity, evaluation of anatomic axis of limbs, and limb length. Examination of spine for kyphosis or scoliosis seen in TB, and examination of muscles. Wasting above or below the joint, seeing in idiopathic arthritis or chronic joint involvement and disuse atrophy. And tenderness of muscles, dermatomyositis. Joints to be examined for swelling, pain, tenderness, and range of movement. If it is arthralgia or arthritis, single joint is affected or multiple. Large joints affected in lower extremities like knees and ankles, and small joints affected in the upper or lower extremities, يعني يسموها polyarticular juvenile idiopathic arthritis. Spindle shaped fingers تصير in rheumatic arthritis, and diffuse swelling of the entire dorsum of hands and foot occurs in sickle cell disease. Scorbutic bleeding of costochondral junction occurs in scurvy and in TB hip. Limb is flexed, abducted, and medially rotated. And the pseudoparalysis, inability to move the joints due to severe pain, occurs in septic arthritis. How the patient moves about the room before and during the examination, as well as during various maneuvers. Balance, posture, and gait pattern. Look for any skin rashes like cafe ole spot, hairy patches, dimples, cyst, tuft of hair, and any evidence of spinal midline defects. General body habitus, any signs of cachexia, pallor, or nutritional defects. Obvious spinal asymmetry, axial or appendicular deformities, trunk decompensation, and evidence of muscle spasm or contracture. The forward bending test is a valuable test in assessing the asymmetry and movement of spine. Any discrepancy in limb length and muscle atrophy, range of motion in all joints and their stability, and any evidence of hyperlaxity. Then investigation هذا general كل الأنواع. نسوي complete blood count and DSR, coagulation factors and monitor test اللي هو نستخدمه for tuberculosis، يعني نحقن إبرة tuberculin intradermally ونشوف الريسبونس. and aromatic factor, antibodies, anti-nuclear antibodies and anti-double-stranded antibodies, ASO titers and synovial fluid culture if needed. General treatment start with education and physiotherapy, including develop exercise program and strengthen muscle and keep the joint flexible. Encourage limb movement and maintain function to prevent deformities. Then analgesic and anti-inflammatory drugs, antibiotic if needed, and erythrocentesis. Agents that reduce inflammation إما نستخدم non-steroidal anti-inflammatory drugs أو drug modifying anti-rheumatic agents. Non-steroidal anti-inflammatory drugs reduces pain in both acute and chronic inflammation, but they are not disease-modifying agents. While the other type ممكن تكون biological or non-biological like infliximab, these directly affect the immune system, and these are steroid-sparing agents نستخدمهم لما تفشل النوعية الأولى أو تظهر ال complications of steroids.
Second line of treatment. نعم.
دكتور بعد أنا خلصت المادة مالتي راح تبدي وياكم بان.
Nice presentation. Thank you very much.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته دكتور.
أنا بان باسل راح أكمل دكتور.
Welcome.
Juvenile idiopathic arthritis. Juvenile idiopathic arthritis present as a chronic joint swelling, pain with a functional limitation for at least 6 weeks of unknown cause that start before 16 years old of age. يعني هو unknown etiology at least 6 weeks onset before 16 years old. هنا الكوز مالت الرسم juvenile chronic arthritis يصير يا إما بالستل disease اللي هو systemic oligo articular أو poly articular، لو juvenile rheumatoid arthritis، لو juvenile ankylosing spondylitis. Other types include infectious اللي هي tuberculosis، rubella and rheumatic fever، Henoscolium berbera, traumatic arthritis, hypermobility, sickle cell disease, psoriatic arthritis, SLE and connective tissue disorder with transient synovitis of hip. Sign and symptom of juvenile idiopathic arthritis: عندنا articular manifestation and extra-articular. Articular اللي هي joint swelling, joint pain, joint stiffness and killing after period of inactivity, joint warmth, restricted joint movement and limbic gait. Extra-articular هي general manifestation في growth disturbance, skin, others and enthesitis اللي هي inflammation باللي يربط بين التندن والليجمنت والمصل. There are 7 types of juvenile idiopathic arthritis. Systemic juvenile idiopathic arthritis affect the whole body. Symptoms include high fever. The child may feel very ill, a bare bell, or develop a rash. The spleen and lymph node may become enlarged. Oligoarthritis were less than 4 joints, often the knee or ankle, and in lower limb symptoms include pain, stiffness, or swelling in the joint. Polyarticular negative, وعندنا polyarticular positive. The negative symptoms include swelling or pain in 5 or more joints. The small joints of the hand are affected, as well as the weight-bearing joint, like knee, hips, ankles, feet, and neck. Polyarticular positive nigger rheumatoid factor is positive, or anti-cyclone crystalline peptide in their blood, and behave like most of adult rheumatoid arthritis. Psoriasis negative. اللي هو kids with this also have the psoriasis rash, a scary red rash that can start behind the ear, on the eyelid, elbow, knees, and scalp. Themselves or clues related with psoriasis يعني عندهم family history. Enthesitis related. This type of arthritis often affected the legs and spine. Kids also might have inflammation at the enthesis area where tendon join bones. Undefined type arthritis that doesn't fit into any of the above categories or fit in more than one category. Criteria for the classification of juvenile idiopathic arthritis. Age at onset less than 16 years. Arthritis in one or more than one joint. The duration of disease more than 6 weeks. Onset type defined by the type of articular involvement in the first 6 months after onset. Body arthritis if more than 5 inflamed joints, or oligoarthritis if less than 4. Systemic disease, arthritis with rash and characteristic quotidian fever اللي هي fever occur every day. Exclusion of other form of juvenile arthritis. Investigation. The diagnosis is essentially clinical. Laboratory investigation are only supportive. أول شي نسوي full blood count نشوف anemia, leukocytosis and elevated platelets. نسوي ESR and peripheral blood film اللي هي marker for inflammation. X-ray of affected joint, look for malignancy. Anti-nuclear antibody, identify risk factor for uveitis ضمن the general manifestation. Rheumatoid fever, assess the prognosis in body arthritis for early treatment. Others include complement assay, ASO titer, ferritin level, immunoglobulin, HeLa B27, synovial fluid aspiration. Treatment عندنا physiotherapy, ophthalmologist and mutational therapy. Physiotherapy avoid prolonged immobilization يعني لازم حركة الطفل. Strength, muscle, improve and maintain range of movement. Second is ophthalmologist. The patient must be referred to the ophthalmologist for uveitis screening and have regular follow-up. Nutritional therapy اللي هي calcium intake. Calcium and vitamin D is advised in patients on corticosteroids. Ensure appropriate protein and caloric intake. هسه another type اللي هو septic arthritis. An infection of the joint space, more common in young children. 50% of the case occur by by 2 years and 75% of all cases by the year. Has an inflamed joint. The mechanism of infection is hematogenous spread or direct inoculation or spread from a local infection. بالهيماتوجينس يا أما بكتيريميا from يعني الجسم كله IV drug abuse, immune compromised state, diabetes and HIV. Direct inoculation اللي هي recent joint surgery, prosthetic joint, steroid injection and trauma. Spread from a local infection, here skin infection or ulcer, osteomyelitis, septic uveitis, and abscess. Clinical feature. In infant, more septicemia rather than joint mania and general feature أكثر من الآن. Baby is irritable, refuse to feed, tachycardia with fever, joint are inflamed, pseudo-paralysis, cheek umbilical cord and AV site for infection. In children, acute pain in single large joint, especially the hip, pseudoparesis. Child is ill, rapid pulse and swelling fever. Overlying skin look great. Superficial joint swelling may be obvious. Local warmth and marked tenderness. All movements are restricted by pain or spasm. Look for source of infection. A risk factor for getting septic arthritis. Neonate, umbilical basal catheterization, central venous catheter, femoral basal blood sampling, osteomyelitis, immune deficiency, joint surgery, thalassemia and diabetes. On physical examination, lower limb antelogic limb in response to tenderness and pain and cannot walk. Upper limb affected part is closely guarded. Marked tenderness, active and passive range of motion are limited. Examine for synovial effusion, erythema, heat and tenderness, a sign of inflammation. Spasm of muscle around the joint may be marked. Patient may hold the joint in a position to reduce intra-articular pressure to minimize pain. Healing. Healing may occur with one of the following. لا يا إما complete resolution يا إما partial use of articular cartilage and fibrosis of the joint, use of articular cartilage and bony ankylosis, bony destruction and permanent deformity. هسه هنا مخطط على treatment، نسوي atherocentesis ندسها microbiology، بعدين نبدي الempirical treatment 1 week intravascular antibiotic therapy، oral antibiotic therapy till blood test and x-rays normalization. عندنا medical general supported control fever and pain, hydration and splitting of the affected limb, non-steroidal anti-inflammatory drug and antibiotic IV for 6 to 8 weeks, then oral. Surgical percutaneous arthrocentesis, arthroscopic surgical drainage, and rehabilitation, physiotherapy and early mobilization. هسه reactive and post-infectious arthritis, defined as joint inflammation due to a sterile inflammatory reaction following a recent infection, triggered by infection in another part of your body, most often your intestine, genitals, or urinary tract. Reactive arthritis usually targets your knees and the joint of your ankle and feet. Inflammation also can affect your eyes, skin, and urethra. Clinical feature. Reactive arthritis refers to arthritis that occur following enteropathic or urogenital infections. The cause is variable and may limit or progress to a chronic spondyloarthritis, include ankylosing spondylitis. 75% of the cases HeLa positive, HeLa B27 are positive. بينما post-infectious arthritis that occur after group A streptococcus or virus. Pain or joint swelling is usually transient, lasting less than 6 weeks, and doesn't share the typical spondyloarthritis patient pattern. Diagnosis: a recent genitourinary or gastrointestinal infection may suggest, but there is no diagnostic test and mostly clinical. Treatment: specific treatment is unnecessary for most cases. Non-steroidal are often needed for management of pain and functional limitation. Intra-articular steroid injection may be utilized for refractory or severely involved joint. Once acute infection has been ruled out, systemic steroids are rarely needed. And thank you.
Thank you very much for your nice presentation. Okay, thank you. Well, I would like to add a few comments and some practical information for you about this very important subject, joint pain and arthritis. Okay, you did well when you start with the definition of arthralgia and arthritis. بتعودن على بدء نذكركم انه at the beginning of the approach you should not forget the anatomy and physiology of that organ or system in the health problem. Okay, from your information in the previous years, just to refresh your mind, in the joint is the space occur between two adjacent bones that are covered with the cartilage, and the joint is lined by the synovial membrane, which is covered by the ligaments and the muscles. والنقص بالجوينت هو الساينوفيال joints بالحقيقة. زين. What about the presentation of the joint problem? How would the child or the infant present to you in the hospital or the clinic who had a joint problem? The older one, we have no problem in asserting that he had a joint when he said that, doctor, I had a pain in a specific joint, okay? But for the infant, how we can know that the patient had a joint problem? Through the following indicators. Either the mother said that he had distress on handling or movement of the infant. Second, where there may be a limitation of the joint movements, or the joints are swollen, or there may be abnormal painful gait, or there may be unexplained screaming or crying for unknown reason. For example, the crying, it could be to the hunger, due to the colic, or it could be to the joint problem. There may be a fever or malaise, just a presentation. Your patient may have fever and malaise, then you have to, without the possibility of the underlying joint problem in your mind or in the differential diagnosis. Before starting the approach, the history and the examination and the investigation, لا بس انك انت تتعرف على الetiology of the health problem. For example, if the adult come to you with the chest pain, now خلي differentiate down on all cause مال chest pain could be cardiac origin or respiratory origin. Cardiac origin, it could be مثلا MI, angina or pericarditis. Respiratory origin could be مثلا pneumonia or other causes. على ضوء الاتيولوجي اللي موجود عندك انت راح تكون الاسئله اللي موجوده بالهيستوري والاكزامينيشن حتى to narrow the gap to reach for the final correct diagnosis. فمثل ما ذكرته انه الكوزز اوف joint pain or erythropathies in general يقسموها مثل ما قسمتوها، لا بس نعلق تعليقات بسيطه عليها. بالنسبه للتروما، trauma is a common cause of the joint pain among children. مقارنة بالأسباب الأخرى اللي هي connective tissue disorder والأسباب الأخرى اللي راح تجينا، نخلي trauma on the top of the etiology. التروما عندنا two types، عندنا يا إما accidental or non accidental. accidental عرضية، non accidental لا deliberate or child abuse هذه متعمد. ومهم جدا إنك from the history or the examination إنك لازم تتعرف إنه whether your patient had non-accidental trauma or is subjected to what is called child abuse. ومثل ما تعرفون child abuse الطفل المضطهد بانواع، ممكن تكون physical، ممكن تكون emotional، ممكن مثل ما راح ناخذ ان شاء الله بالسيمينار مال ثيرابي ثرايف انك تحرمه من الغذاء بصوره عمديه متعمده. التعرف عليه من خلال انه تتكرر التروما، ان اكو ديسكريبنسي بين الهيستوري وبين الاصابه، الوضعيه الطفل، السوشيال باك جراوند، اني هذا ما يخص التروما. السبتيك arthritis, as you have mentioned, we have to differentiate it between the osteomyelitis. Septic arthritis, joint space inflammation, while the osteomyelitis is the infection of the metaphysis of the shaft of the bone. نقدر نقول الاوستيومايلايتس it is more to the orthopedics. الرياكتيف ارثرايتس، الرياكتيف ارثرايتس اذا اريد نقرب المعنى مالتها تذكرنا بمصطلح parenteral diarrhea. Parenteral diarrhea is a patient who has got gastroenteritis due to a pathology away from the GIT. يعني patient عنده otitis media، عنده نيمونيا، عنده انترانت انفكشن، ممكن يصير عنده gastroenteritis، هي يسموها parenteral diarrhea. الرياكتيف ارثرايتس الباثولوجي، الفوكس اوف ذا باثولوجي، المين باثولوجي away from the joint itself، هذه يسمونها reactive arthritis by different mechanism. It could be for example مثلا immunological mechanism, hematogenesis, anyhow. ومثل ما ذكرتوا الفيرال انفكشن، البكتيريال سالمونيلا، والانفلاماتوري بول ديزيز، هذا فيما يخص الرياكتيف ارثرايتس. بالكتب القديمه الكونكتيف تيشو ديس اوردر يسمون الفلاجين فاسكولار ديزيزز، now يسموه كونكتيف تيشو ديس اوردر، حتى يفرقون الروماتويد ارثرايتس اللي موجود عن الادلت فسموها جوفينال روماتويد ارثرايتس. الاس ار اي ممكن تحدث بالادلت وبالتشيلدرن. عندنا اكو انتيتي ديرماتومايسايتس كذلك تحدث بالتشيلدرن يسموها جوفينايل. السكليروديرما والانكيلوزيك سبونديلايتس والاذر سبونديلو ارثروباثي عاده ما تكون مور بريفالنس والانسدنس مالتها بالادلت. البرزنتيشن مال انكيلوزيك سبونديلايتس والسبونديلو ارثروباثيز اللي عاده يكون lower part بين تخلي possibility مال osteochondritis، possibility مال lumbar disc herniation osciatic and other causes. البوست انفكشياس وبالتحديد بوست ستريبتوكوكال روماتيك فيفر in the past كان البريفالنس مالته نفس كل اسبوع، but because of the use of the antibiotic اللي هو ستريبتوكوكال البنسلين الانسيدنس مالتها nowadays very rare الروماتيك فيفر ما نشوف حالات روماتيك فيفر كثيره and that's the reason why if one asks you why we should give a 10-day course of penicillin therapy to a patient who has got tonsillitis الجواب to prevent the remote complication اللي due to the post-streptococcal rheumatic fever or post-streptococcal glomerulonephritis as a complication of the acute bacterial tonsillitis. الفاسكولات السندروم مهم جدا ولا ننساها على اختلاف انواعها اللي تشمل السمول سايز والميديوم سايز واللارج سايز بلاد فيزل. اللي يهمنا من موضوعنا واللي لا يكاد يخلو امتحان نظري وعملي منها هو الفاسكولايتس اوف ذا سمول بلاد فيزل بالتحديد هينوشايلم هارمون. هاي مهمه جدا. كواساكي تاكاياتو الغونا ارثرايتس نودازي البريفالنس والانسيدنس مالتها in our communities very rare. بس هينوشايلم بربره we should know a lot and detail of it. The hematological causes, as you mentioned, the hemophilia, leukemia, sickle cell anemia. السورايتك ارثرايتس من ضمن خصائصه مثل ما ذكرتوا انه عنده كاركترستيك سكيلي سيلفري سكين ليجن وبالنسبه للجوينت انفولفمنت راح يكون عندي ديستال انترفرنجيال جوينت وراح يكون عندي نيل بيتنج فهذه الخصائص مال السورايتك ارثرايتس. الفاكسينيشن تكون كومن وذ الروبيلا صحيح رايت. الجاوت ارثرايتس ما يطلق عليه بالجاوت الملوك ارثرايتس due to the high uric acid hyperuricemia especially after a heavy meal overnight and arousal at the morning. The king complained of severe extinguished pain in his big toe. البيك 2 يكون كاركترستيك هو الميتاتارسال جوينتس involved بالجاوت ارثرايتس والكوز هو عاده هايبروريثيميا هاي يوريك اسيد وتكون very painful very extinguishing painful arthritis هو يعتبر arthritis. Of course we should not forget disorder اللي هي نفس البوني تيومر ولا البرايمري اور ميتاستاتيك. جراوندين نتوقف شوي على جراوندين الم النمو.
دكتور اعتذر عن المقاطعه الوقت خلاص راح اسده ونبدا من جديد.
اوكي
تمام.